Hello, and thank you to the team of the World Evidence-Based Healthcare Day for reaching out asking for this short testimony. I am Dr. Guylène Thériault, a family physician from Canada. Until recently, I chaired the Canadian Task Force on Preventive Healthcare. This group, consisting of volunteer clinicians with expertise in evidence, was supported by evidence synthesis groups, methodologists, and epidemiologists. It was created to provide evidence-based recommendations to primary care clinicians. From the start, it was clear that the task force had to be independent, meaning apolitical, and at arm's length from the government. This was the case until May 2023, when the U.S. Preventive Services Task Force published its draft recommendations on breast cancer screening. They recommended routine screening starting at 40 years old. In Canada, screening varies from province to province. At that time, most provinces did not recommend screening starting at 40. The Canadian government asked the task force to prioritize updating this guideline, which meant putting work on hold for every other guideline. We took this as a challenge to develop a guideline that was rigorous while doing it more quickly than usual. For this guideline, we examined many types of evidence, including evidence on women's values and preferences. We also consulted many groups for their input. Our evidence-based recommendations stated that women 40 to 74 should be provided with the information on the benefit and harms of screening, so that they could make their own decisions. But advocacy group would not support this recommendation since we did not recommend to systematically screen women 40 to 49. Pro-screening groups have been active in Canada for decades, but this time around they had the ear of the politicians. Because of their influence, the task force activities are now on a permanent pause. In fact, Canada's internationally recognized group has been directed to disband by March 2026. This is not science, this is scientific censorship. Patients and physicians have trusted the task force in its methods for years. More than 1,800 individuals, mostly primary care clinicians, signed a petition to lift the pause, without success. The government's decision to set aside the evidence will have a lasting impact on the information provided to primary care providers, patients, and Canadian citizens. If this situation can happen in Canada, I am concerned that it could happen elsewhere. Thank you very much, and have a nice evidence-based healthcare day.